For many years I've worked in the emergency medical stream, mainly in Llandoch, in their MEAU up there. So I've always felt that you're able to manage a patient to a certain level, and then you've always had to call a doctor in, which is quite frustrating when you know what the next step is. So you can take forward with patient group directives, sort of an asthmatic that's having an exacerbation, you can give them the immediate treatment, but then there's a point where you can't prescribe prednisolone, you can't prescribe the fluid that they might need, so you have to call a medic in, and then they take over, and then you do what they ask you to do. I've always known the pathway but been unable to action the pathway, so this role, when I'm qualified, will allow me to prescribe that treatment and manage that patient completely, so they get seamless care until they get post-take with a consultant. So when I was nursing, I was a deputy sister. My priority then was the flow of the patient through the unit, sort of, stopping the ambulance delays, the patient waits, sorting out staff breaks and staffing. I had more of managerial responsibilities, which we still have to a degree AMP-wise, but not specifically to a staff base, off-duty, annual leave. So you're allowed to have a bit more of a more directed role towards putting the patient through the flow quicker, but actually from assessment, management and discharge, whereas before I'd just be managing space and patients and staff. You'll never get away from having the experience of the registrar around and the consultant around, but we are enabling the pathway to move quicker because we complement. We'll never replace them, and I think that is, you have to be careful, because as soon as somebody says, oh, you're a doctor, I'm not a doctor, I've never been to medical school, and I recognise that, but I've got a wealth of experience. I've been a nurse for 32 years, so I've got a wealth of experience there that can complement that emergency stream and help that flow quicker. So there's a lot of ACPs out there, not just nurses, the physios are out there. I've just been on a patient assessment course with those. GP nurses are out there as well. So for me, I think you need to get grounding. I think you need to be experienced in your practice before you can take on this role. So whether you're an ITU nurse and your wealth of experience is ITU, personally as an ACP, I couldn't go to ITU because that's not my background. So I'd suggest that you had a good grounding in medicine and surgery, emergency medicine, before you take that experience forward. Because I think if you put yourself up as an ACP, you have to have, people have to look at you and think, she's experienced.